I thought I was going to medical school to do OBGYN, and actually matched in that my first year. I did a transitional year here at UMC in Jackson and did a oncology rotation and loved it. I'd never been a part of a medicine where patients said thank you, and it wasn't even the thank you, but you felt like you were actually giving them something, and it was the most rewarding experience of my life. I chose oncology, and as I tell my family, I backed into my profession. It was my very first patient that I took care of, and I took care of her intimately. And I remember from the day of diagnosis to the day in which we began her treatment plan. And then later on, when I actually was in my oncology training, I got to follow her after she had survived that difficult time. I have been on both sides of medicine. I've been on the side where you are trying to understand what the physician is telling you. I understand what it's like to hear the sirens in your ears and to not be able to absorb anything that they're saying. It takes time, and it is a very catastrophic experience to go through cancer care, to go through the diagnosis of cancer, and to have to go through treatment. But I get that. I've been on both sides. I feel like I am very patient with that. I often have patients come in the first time. We talk about everything, and I'm like, you know what, go home. We're going to talk about it again the next visit. Write down everything you need. Well, I'm lucky that I feel like I take care of all the cancers and all the malignancies. I do see a lot of lung cancer and a lot of breast cancer. I enjoy taking care of both women and men. I'm thrilled at the advances we've made in both lung cancer as well as in breast. And most of our breast cancers now are actually very treatable and often very curable. I think the same thing can be said for lung. We've made developments. We have more specific targeted therapy. Patients are living longer, but most importantly, they're having better quality of life while they go through their treatment. We're tailoring the medicine. Same thing with colon cancer. Patients used to live just 2 years with bad metastatic disease, and often, it's a chronic disease. They live 5, 6, even longer. Every case is different, but it's exciting to be where we are. As a physician who takes care of cancer patients, I see my role as the person who guides them through this difficult time. It is my purpose to navigate them through both the diagnosis, the treatment, and then later survivorship, and to keep them healthy and with their family and their best interests at heart.